Hello. Today we are going to discuss about integumentary system, the subjective assessment. I'm Mrs. Jancy Mary, clinical instructor at Triple M College of Nursing. Objectives. At the end of this session, you would be able to know about the assessment of integumentary system and obtain an integumentary history. That is the subjective part. Introduction. A comprehensive assessment of a dermatologic condition includes the history given by the patient and the findings of the physical examination of the integumentary system. So the patient history and physical examination should also occur in an appropriately private area to ensure privacy and dignity, which is preferably in a natural setup or natural lighting. A preliminary history of a dermatologic problem can be abbreviated to 3 key questions, which is to evaluate an evolution, symptoms, and treatment to date. So data, anything stated but cannot be verified, for example, pain, feelings, they are known as a subjective data. So facts and opinions. What are facts and what are opinions? Anything that cannot be proven is known as a subjective, that is an opinion. Anything that can be proven is known as objective. Often, objective statements are being factual statements. So now we are going to discuss about the subjective data, that is either opinions or biases or the questions what we ask to the client is known as the subjective data. So we are going to discuss in detail about the skin, hair, and nail subjective assessment questions. So what is the purpose of the history collection? The purpose of the integumentary history is to mainly identify the disease of the skin, systemic disease that have skin manifestations, physical abuse. Was there been any risk for the precious or ulcer formation? Was there any risk for skin cancers? And to know the need for health promotion and education regarding the skin. So what is the history collection? Present illness. How do you ask for the present illness? We have to look for onset, location, type of change, precipitating factors such as stress, weather, drugs, exposure to any allergens. What are the cardinal signs and symptoms? When it comes to skin, we have to look for any skin rashes, lesions, itching, dryness, oiliness, and how do they get treated? What is the method of relief? Medications, either they apply lotions or soaps. And surgical excision of skin lesions, change in color or bruising, infections, skin odor, bathing patterns, soaps and oils, what has been used. When it comes to hair, look for or change in the texture, condition and amount of hair, usage of shampoo and hairsprays. And when it comes to nail, look for the changes in condition of nails and cuticles, nail breaking, splitting, inflammation, and nail enamels, what is used. Others are exposure to any chemicals. PUVA is nothing but the Soralin ultraviolet light therapy, A therapy, that is radiation and immunosuppression. And past skin disease, ask for or look for any exposure of how many years of exposure to sun and use of tanning and other environmental factors. Recent change in a rat or a mole, any sore that has not been healed, tick bites, any adverse effects of medications, allergies, seasonal or climatic effects, recent changes in hair growth and distribution, recent changes in nails, for example, ridges, thickening, or any color bands observed recently, and any changes in the sensation of pain, heat, and cold, and also look for thyroid, endocrine, circulatory disorders arised recently. Health survey. So when it comes to the health survey, as a nurse, you can use the old card mnemonic to follow up the questions in order to obtain a full description of the condition. For example, if a patient is reporting to a clinic with a rash, then ask for onset. any skin related thing, you have to go according to these steps. Onset. Onset is when did it start? Have you started any medications or changed any existing medications? Have you been out of the country recently, or have you been to any other part of the place where you are located? Any migrations? And have you ever had similar symptoms in the past? When it comes to location, where exactly it is located, and has it changed in its size or any spread to another part of your body absorbed recently? And coming to the duration, how long have you had it, and does it come and go? What are the characteristic symptoms? Describe your rash. What did it first look like? Has it changed? Associated manifestations. Does it itch? Is there any discharge? And when it comes to the relieving and exacerbating factors, have you used or done any that seems to make it better? And treatment. Have you put anything on it to treat it? So this is the old card mnemonic method. You have to look for onset, location, duration, characteristic symptoms, associated manifestations, relieving and exacerbating factors, and treatment. Medical history. When it comes to medical history, you will have to ask the patient about the sickness. Any skin disease such as melanoma or eczema or psoriasis have occurred. Do you have any diabetes or peripheral vascular disease? Do you have any allergies or food sensitivities? Do you have ever had a severe sunburn? How many second-degree sunburns have you experienced thus far? And have you ever been on any corticosteroidal applications for more than 2 weeks? What is the prescribed or over-counter medications do you take? And what is your immunizations schedules, or what have you taken thus far? This is the medical history you will have to collect from the patient. Moving on to the family history. Do any family members have the same or similar symptoms such as what the patient is going to state? And you also should ask about anyone in the family had melanoma, eczema, or any psoriasis or any skin related disorders. Does anyone have any allergies in the family? These are the questions you should keep in mind when it comes to the family history. Occupational health pattern. What is the type of work the person is exposed to? You to assess the exposure of chemicals or any irritants. Stress and coping pattern. How is your stress level, or how do you cope when you are stressed too much at workplace? So these are the main history you need to collect. Moving on to the social and personal history. Describe your bathing and shampooing routines. Have you changed any product or brands recently? Do you wear false nails or wigs? Do you go to a nail salon or gym? How much sun exposure do you receive daily? How often do you use sunscreens? What SPF value of sunscreen do you use? Do you perform any skin self-examinations, and how often you use that? How often you perform it by yourself? Are you exposed to any chemicals or radiation at work or at home? What are your hobbies? And describe a typical day's diet. So these are all very important and essential to know the subjective part, the history collection from a patient who is coming to a clinic with skin disorder. What are the common concerning symptoms? You will have to look for any rash, lesions, non-healing lesions, bruising, moles, or hair loss, and any nail abnormalities. These are the main concerning symptoms when you ask about the subjective assessment. When you collect the history from the patient, you need to ask all these questions to know the complete history of a patient. So I'd like to conclude my topic. Subjective data is gathered from the patient telling you something that you cannot use by your five senses to measure it. So if a patient tells you that they have had diarrhea for the past 2 days, that is either subjective or objective. Yes, it is a subjective. You cannot know what information other way, what is behind or what is happening with the client. So what is being told is known as the subjective assessment or the history collection. So take a deep breath, go to the root of the information. It is very simple to know that from the patient, you're going to collect or gather the informations. Yes, hope you understood the topic. These are some of the references what I had used. Thank you.